welcome to The Explainer. I am absolutely thrilled you're here today because we're diving into a genuinely fascinating breakthrough in the world of cosmetic dermatology. You know, if you've ever looked into anti-aging treatments, it really can feel like a total maze of extreme options and heavy scientific jargon. Well, today we are going to cut right through all that noise. We're going to unpack the science behind a completely fresh approach to skin rejuvenation, and we'll do it step by step, using the clinical data we have right in front of us. Let's get into it. So, here's the million-dollar question. Can you soften wrinkles without losing your smile? For decades, the aesthetic industry has pretty much forced patients to make a really tough choice. On one hand, sure, you want smooth, youthful, hydrated skin. But on the other hand, there's this very real, very understandable fear of the unnatural, frozen look, right? We've all seen that Hollywood trope of the actor who literally can't show surprise anymore. It's this deep fear that in order to lose your wrinkles, you might actually have to sacrifice a bit of your natural expression, your warmth, your smile. Okay, so let's dive into this. Enter MesoGel BTX. Coming straight from the Dermatological Choice MesoGel collection, this product is perfectly positioned as the innovative middle ground solution to that exact dilemma we were just talking about. It's an injectable dermal device that promises to completely change how we approach the early signs of aging, acting as a much-needed bridge between the two extremes in aesthetic medicine. Here's our roadmap for today's explainer. First, the anti-aging dilemma. Second, introducing MesoGel BTX. Third, unpacking the 2-in-1 formula. Fourth, modulating, not paralyzing. And finally, target areas. Don't worry, we're going to break down all the complex cellular mechanisms step by step.
Kicking things off with Section 1, the anti-aging dilemma, finding the middle ground.
Traditionally, we've been stuck between two extremes of anti-aging. On the left side of things, you have botulinum toxin type A, which most of us just know as traditional Botox. Now, this requires a deep intramuscular injection, and hey, it's incredibly effective at stopping wrinkles, but it comes with a very real risk of localized muscle paralysis. If it's done too heavily, you get that frozen effect. Now, on the far right, we have topical serums. These are incredibly safe. I mean, you literally just rub them on your face, but they're limited to epidermal surface absorption. They basically just sit on top of the skin, offering a bit of temporary hydration without actually addressing the deeper microtension that's causing the wrinkles in the first place. So historically, it's been this frustrating choice between extreme intervention and, well, superficial results. Moving right along to Section 2, introducing MesoGel BTX, the hybrid solution. So MesoGel BTX is engineered specifically to be this 2-in-1 hybrid. It is an intradermal micro-droplet injection, which is often referred to in the industry as a meso-injectable. And what that means is it goes deeper than a topical serum, getting right down into the dermis, where your skin's structural quality is actually determined. But, and this is absolutely key, it doesn't go nearly as deep as a traditional toxin that hits the muscle. It's custom designed for advanced bio-revitalisation and surface line softening all at the exact same time. Now, a crucial point here is understanding what bio-revitalisation actually means in this specific context. I know, it sounds like a bit of clinical jargon, but it simply means a dermal treatment that does two distinct things simultaneously in a single syringe. First, it restores hydration and elasticity. Second, it actively reduces expression microtension. Think of it like this. It's plumping the skin with deep moisture while gently telling the superficial skin layers to just relax. Let's transition over to Section 3, unpacking the 2-in-1 formula. HA matrix and peptides. Let's see how this actually builds. Okay, looking under the hood at the dermal elasticity and hydration profile, the formula is basically split into two main chunks. The first chunk is a 2% high-purity, non-cross-linked hyaluronic acid matrix, sitting at a concentration of 20 milligrams per milliliter. This is what provides that immediate dermal plumping and deep structural moisture. It rapidly restores your skin's fluid balance. The second chunk of the formula is an active neuromodulating peptide complex made up of 3 ingredients: GABA, arginine, and lufacil. So while the hyaluronic acid handles the heavy lifting of hydration, these 3 neuropeptides go to work directly on the nerves and microcontractions. Let's look exactly at how that triple neuropeptide complex works as this brilliant chronological 1-2-3 punch. It works by dampening signal transmission right at the neuromuscular junction. Here's how it plays out. Step 1. Arginine reduces the release of acetylcholine at the presynaptic junction. Essentially, it's just turning down the volume of the signal that's telling the skin to contract. Step 2, Lufacil works in total synergy with the arginine to lower neuronal excitability altogether. And finally, Step 3, GABA swoops right in to provide this fast-acting relaxation of those surface microcontractions. It's a beautifully designed multi-pathway blend meant to soothe the skin rather than paralyze it. And that brings us to Section 4, Modulating Not Paralyzing, the Dimmer Switch Effect. Now, this brilliantly illustrates the most vital scientific distinction in our whole explainer today. Traditional botulinum toxin type A utilizes something called irreversible SNAP25 cleavage. I want you to think of that like taking a pair of scissors and just completely cutting an electrical wire. The muscle is entirely cut off from the signal, resulting in localized paralysis, and you have to wait 3 to 14 days for it to actually kick in. MesoGel BTX, however, uses multi-target signal modulation. So instead of cutting the wire, it acts more like a dimmer switch. It just gently turns down the intensity of that microtension. And because of the hyaluronic acid, the onset gives you an immediate glow, which is then followed by progressive relaxation from those peptides. For anyone who's even remotely cautious about aesthetic treatments, this is absolutely the ultimate takeaway. Because MesoGel BTX works like a dimmer switch on the surface of the dermis, it preserves 100% of your natural facial expression. Your full movement is completely preserved. There is no deep intramuscular injection happening here, which means you entirely bypass the risks of ptosis, which, is that dreaded drooping eyelid or any weird facial asymmetry. You are getting the smoothing effect of the peptides combined with the intense hydration of the HA, all while keeping your natural smile totally intact. No way around it, it's a real game changer. All right, let's look at practical application in Section 5, Target Areas, where MesoGel BTX shines. So where do we actually use this? Well, MesoGel BTX is formulated for intradermal application across 3 key regions that tend to show early signs of aging. On the face, it specifically targets those dynamic areas where we show the most emotion. It softens up dynamic forehead lines, the crow's feet around the eyes, and those perioral wrinkles right around the mouth. But it doesn't just stop at the face. For the neck, it is highly effective at restoring hydration and smoothing out that frustrating surface creepiness we all kind of dread. And finally, the décolleté, or the chest area, where it refines skin texture and dramatically reduces the fine, superficial wrinkles that are so often caused by years of sun exposure. It's delivering comprehensive surface renewal, but without adding any excess unwanted volume. As we wrap up and look at the clinical safety profile, this quote really hits the nail on the head and sums up the entire value proposition of the MesoGel BTX formula. 100% biocompatible and non-paralyzing. The high-purity hyaluronic acid ensures smooth, even integration with the absolute safety of being entirely biocompatible with your own body, while that peptide trio ensures the results are completely non-paralyzing. It's just a remarkably elegant, science-backed approach to restoring skin vitality. Which brings us to our final thought for today's explainer. As aesthetic science rapidly evolves away from irreversible nerve cleavage and freezing muscles and moves toward this highly sophisticated multi-pathway modulation and deep hydration, is the frozen look officially a thing of the past? The data we've unpacked today certainly suggests that the future of anti-aging is all about preserving exactly who we are while simply helping our skin look its most vital, hydrated, and relaxed self. Thank you so much for diving deep into the science with me today, and as always, keep exploring.